Another serious assault on a nurse at Christchurch's Hillmorton Hospital is being blamed on inadequate staffing and the lack of an intensive care unit. Several nurses at the hospital's acute inpatients unit have told RNZ a nurse was strangled and dragged across the floor by a psychotic patient over the weekend. This comes just weeks after RNZ revealed that over the past 12 months, staff at Hillmorton's adult acute inpatients unit were assaulted up to 30 times a month. Logan Church reports.
Alarm bells rang through Hillmorton's acute inpatient unit on Sunday as a nurse was strangled and dragged across the floor by a patient. A nurse, who didn't want to be recorded for fear of being identified, says it is getting too much.
There were several assaults on nursing staff in acutes over the weekend. One in particular was very nasty. A female nurse was strangled, then dragged along the ground by a psychotic male patient. The situation was exacerbated by inadequate staffing. It's not good. Morale is at rock bottom.
The nurse says part of the problem is the building itself. They say an intensive care unit would be a huge help, as, if properly staffed, it would allow nurses to more easily manage the most volatile patients. The acute unit used to have an ICU, but in 2013 management scrapped it, instead creating 3-bedded high care areas in each of the 4 wards.
These high care areas are isolated and dangerous for patients and staff alike. Often inexperienced nurses are placed there to care for psychotic, aggressive and dangerous patients. Many of these young nurses are anxious and at times downright scared.
So, what makes these high care areas so dangerous? We asked the Canterbury District Health Board for a tour of the facility to see firsthand what the problems are. They refused. But here's what another nurse told us about the setup.
In our high care areas, the offices only have one entry point into the high care area. And there have been times when nurses have been locked in the high care area in the high care area office with no way of escaping. So they've been trapped because there's only one entrance.
As an immediate fix, the nurses' organisation's John Miller is calling for security to be placed on the wards immediately.
We've asked the DHB again to look at, as an interim measure, to look at having security on the wards. We have raised this before, and the DHB have given good reasons why they aren't keen, but and in the long term are looking at potentially another type of employee, another type of support worker in that environment. But we were hoping and want them to look again at a short-term interim measure around getting some security on those wards.
How soon would you like that to happen?
Tomorrow. Actually, today.
John Miller says a steering group, made up of nurses and management, is being set up to look at addressing issues at the Hillmorton Acute Unit. It had its first meeting last week, and Mr Miller is hopeful it will lead to change. We requested an interview with the Canterbury DHB about last weekend's incidents. It said it would not be able to comment before deadline. The question on these nurses' minds is now whether safety will be beefed up at Hillmorton and how long they'll have to wait to see action. In Christchurch for Checkpoint, call Logan Church, Tēnei.